Hello there. So we're going to move on now in animal husbandry to look at horses as patients in large animal practices. And we've left farm animals behind for the moment, and we're going to look now at some of the skills you'll need to provide care for horses. So if you have a look at this section on Moodle, the first set of notes is called Equine Husbandry. And the first part of that handout goes through breeds and types of horses, some common terminology, how to identify a horse and to check its markings from its passport, and an overview of some of the common equestrian sports that you may find people using horses for in this part of the world. I'm not going to go through those, but have a read through them, and if that doesn't make sense to you, you can pop your queries onto Moodle. I'd also recommend Large Animal Clinical Procedures for Veterinary Technicians by Kirsten Holcrew Bowling. The second or third editions are out now, and either of them is very good. They've got good chapters in them on large animal handling, including horses. They are American based, so there's some bits that aren't that applicable to here, and I'll point those out as we go along. But generally, it's a good source to work from. Okay, if we have a look then at handling and restraint of horses as patients, a good overview of this is in McKernan's clinical textbook for vet technicians. So if you can't get your hands on a copy of Large Animal Clinical Procedures, the chapter in the 9th edition on animal handling and restraint has good sections on horses as well. So just in terms of handling horses, if you have a background in pets, you may find it quite different to work with horses because they're prey animals, which means that their whole kind of lifestyle and evolutionary behavior pattern has evolved to make sure that they stay safe and don't get eaten by predators. They also are grazing animals, so they spend a lot of time on open spaces. So if you think of Mad-Eye Moody in Harry Potter, if you remember, his advice to the students is constant vigilance, and that's really what a horse, that's how they think. Their whole world is about watching out and trying to make sure nothing is sneaking up on them. So if you remember, Mad-Eye Moody could look behind himself with his eye. Horses are a bit the same. They've got this really wide field of vision, and if anything in that vision or in their hearing startles them, their first response is to run away from it. So that means when we go to handle them, we'll find that there's things that work well and things that don't work so well. As I've said, they're prey animals. So if something scares them, their first response is to run away. So that's their initial, if anything is a threat or potentially a threat, they'll flee from it. That's their first instinct if they get startled. This means that they're not that effectively motivated by food. So unlike dogs and cats who are predators and have to work to get their food, with a horse, the food is there, they put their head down and there's grass underneath them. If they get distracted by food and get eaten by a predator, that's obviously not a good evolutionary outcome for them. So you'll find that while they like food and they'll certainly take it from you, it's not a good way to motivate or reward them, and you can very rapidly produce a spoiled horse that nips you when it wants food. So my advice is when handling horses, if it's your own horse and you want to feed it treats, you can, but it's very, very unprofessional to do so to horses that don't belong to you. Clients and owners won't thank you for it, and you may lull yourself into a false sense of security by thinking that the horse is tolerating the procedure when it's not really. It doesn't make it any safer to handle. So my advice in general is, if you want to reward a horse, show them that you're trustworthy, but trying to bribe them with food isn't really a good way to go. They do, however, respond very well to calm and quietly confident handlers. So they're prey animals, they're very attuned to social cues. They live in groups normally. So if one animal gets tense, the rest will as well, to see what's going on. They'll also pick up on human behavior like that. So if you're nice and calm and relaxed, they'll be calm and relaxed. If you get wound up, they'll get wound up. So it's really important to remember that they will pick up on your behavior and respond accordingly. So when it comes to handling them, people that have done it for years make it look very easy. There's minimum fuss and the horse just does what they want, but it is something that comes with practice. None of us are born able to do it. So my advice is, any chance you get at all to handle horses, take it. The good news is horses are stronger than people, so we don't rely on strength to control them. If you think of the number of owners that drag their dog around the place on a lead, or the dog drags the owner around the place, that obviously won't work with a horse. They're just so big and strong that if they try and pull away from you, they're gone. So horse handling is about coaxing them and cooperating with them and asking them to do something and getting them to agree with you rather than trying to fight with them. So you will find calm, sympathetic handling is what they respond well to. The other thing about them I say to students is, you know, they're very perceptive animals. You can't lie to them. So if you're wound up and anxious, they will pick up on that. And, you know, you can't tell them, oh no, everything is fine. They will respond to how you behave around them. So it's important to recognize that. If you find yourself starting to feel a bit stressed, you know, stop and take a breath and calm down, or go and get help. If you carry on while you're getting agitated, it's just asking them for trouble. So that is important to keep in mind. So a few basics of handling them. The vast majority of horses you'll find respond to handling in the same way. So there's a culture of horse handling that's grown up in cultures that keep horses, including their own. If you think about it, during a horse's life, they're often owned by lots of different people, and they have to be all taught the same basics. If everybody who trained a horse used different ways of doing it, we'd end up with horses that would be very confused when they move to a new home. So there's a culture of consistency, and you'll find that, you know, there's rules that we use that the horse and the humans are both familiar with, and it makes for handling a lot more straightforward. So a few things to bear in mind. Traditionally, the left side of the horse is called the near side, and the right is called the off side. Not sure why that is the case, but that's the case. And horses are traditionally handled from the near side or the left-hand side. So if you want to catch a horse and you walk up to it on the right-hand side, it's going to be a bit bemused. Most horses would be too polite to mention the fact that you're on the wrong side, but they won't really know what to do. Whereas if you handle them on the left, that's where they expect you to be, and they'll be much more cooperative. It also means that if you're right-handed, which most people are, you're using your dominant hand to lead the horse. So it makes sense for both the horse and the human that we stick to this and work on the left. So as a general rule, stay on the left side unless you have a reason to be somewhere else. So 9 times out of 10, we're going to handle horses from the left. A couple of golden rules. We've mentioned being calm and relaxed around them. The vast majority of horses are very gentle and won't do anything to you. But if they do get a fright, or if they do try to kick you, they're too big and powerful to take a chance with. So we never, ever, 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 ever stand directly in front of a horse. And we never, ever, ever stand directly behind or walk behind a horse. The reason for that being is that if they kick out with their hind feet, they'll kick straight behind them to a distance of about 6 feet. If they rear up and hit you with their front feet, you have to be straight in front of them. So standing beside them on their left-hand side is usually the safest place to be. So if you remember nothing else from today, remember these 2 things: never stand directly in front of them, and never walk or stand behind them. So just to show you on the image here, and the red squares indicate the areas we want to stay out of. We don't want to be directly in front or directly behind the horse. A safer area, now note it's not a safe area, there's no risk-free area, but generally we want to be on the horse's left-hand side, between about its ears and its last rib. That's usually the safest work area. That's where the horse expects you to be. They can see you, you can see them, and you're out of the kick range. So it's a good place to be. Remember as well, horses have eyes on the side of their heads. They have a very wide field of vision. So even if you stand back here at the back of the square at the horse's last rib, they can see you without moving their head. They have a blind spot directly behind them and a small blind spot directly underneath their nose. Other than that, they can see all around them without moving their head. In terms of handling them then, you never ever take a horse out of a stable without a means of head restraint. And 9 times out of 10, that's a head collar and lead rope, sometimes called a halter. And I tend to refer to it as a head collar because a halter can be a different thing depending on who you ask. So head collar and lead rope is the equivalent of a slip lead for a dog. It's the basics. Horses come in a wide variety of sizes, so you need to use a head collar that fits them. And it also needs to be in good condition. If it's torn or damaged or frayed and it breaks, or if the clip on the lead rope is worn and it's inclined to open, it's obviously not a recipe for safe handling. So make sure that they fit and they're in good condition. There's a video on Moodle on how to put one on. You can practice this when you come back to college as well, and you can practice it on our horse handling experience in 2nd year. But it's the basic thing you will put on a horse before you go to do anything with them. In terms of terminology, you'll find with equipment for horses, remember we said they're handled from the left-hand side? That means the buckles to open and close and adjust them are found on the left-hand side. So if you take a halter in your hands and put the buckles on the left-hand side of the horse's head in your mind, you then be able to orientate yourself. So this part that goes behind the ears is called the headpiece. So in this photo here, you can see it going up behind the horse's ears. This buckle adjusts it on the left-hand side. Then there's two cheek pieces down the sides. There's a throat lash that goes underneath the animal's larynx. There's a tie ring on the bottom underneath the muzzle, and then we've got a nose band which goes around the muzzle. That's got a nose piece over the top and a chin strap on the bottom, and the tie ring is in the middle of the chin piece. There are two side rings, one on the left, one on the right. You can see one of them here. Really important point, when you're attaching the lead rope, always attach it underneath the muzzle on the ventral surface of the head. If you attach it to the side rings, you have no control. The horse can just turn his head and drag you with him. Their head and neck weighs more than you do, so you're not going to win a pulling match with them. So really important, always attach your lead rope via its snap tie or catch onto the tie ring and never onto the side rings. Okay. Note as well that this connecting strap goes underneath the head, not up the front of the horse's face. If you see a strap up the middle of the head here, the head collar is on upside down. So it's a sign to readjust what you're doing. In terms of fitting them, you want the nose band to be halfway between the eyes and the nostrils. If it's too high up, it's going to press on their cheekbones and squish them. If it's too low down, it's off the nasal bones onto the soft tissue of the nostrils, and it's going to occlude their airway. It's also inclined to slip off. So important to adjust it to fit. Likewise, you want the headpiece behind the ears, and just so that it's snug. We want to be able to fit 3 fingers underneath the straps. So that's a general rule of thumb. If you put 3 fingers underneath the strap so that you can lift it off the horse's head, it's not too tight, but it's also not going to be too loose or it'll fall off if they shake their head. So that's a useful rule of thumb. So checking for fit, 3 fingers underneath the noseband, 3 fingers underneath the headpiece. That's usually a good fit. When you're not leading a horse, we can tie them up. So in this part of the world, we always tie our horses up to a loop of string or baling twine. They're trained as youngsters to respect that, and we use a quick release knot. We practice those earlier in the semester. It's really important that the rope is short enough that when they try and put their head down, the rope doesn't touch the ground and they can't get their legs over it or get tangled up in it. If there's a way to get tangled up in something, a horse will find it and they'll injure themselves. If they get caught up, they'll panic and they'll thrash around until either the rope breaks or they break, and usually it's them that breaks. So we want to avoid that. So tying them up, we want to keep the rope between the head collar and the string no more than 18 inches in length. So 12 to 18 inches is plenty. If they can get their head down to the ground, they'll get their leg over the rope and they'll get themselves tangled up. So you'll find horses are routinely tied up. Say if you're in a racing yard or riding stables and you go in to tack a horse up to exercise it, put a saddle on it, you'll normally tie the horse up to do that, or you'll tie it up when you're brushing it or grooming it. That allows one person to safely work around the horse. For most vet procedures, they're 2-person jobs. This is one of the reasons why equine hospitals have high staffing rates. For a vast majority of invasive equine procedures, if we're taking the temperature or we're putting taking x-ray, or we're injecting a horse or putting needles into it, you'll generally have a second person there to help you and hold the horse. It's unsafe to do invasive procedures on horses on your own. You're just risking getting hurt, so don't do it. So that's the vast majority of horses will let you walk up to them from their left-hand side, and they'll stand there while you put a head collar and lead rope on them, and then they'll follow you around when you lead them. However, there are a few other tricks and we might need. Most horses are placid and will go along with you, but if they're hurt or they're injured or they're in pain or they're not used to people, or they're, say, a baby, or it's a horse that doesn't know you, they may be difficult to handle and you may need additional restraint. So there's a couple of things we can do. A simple one is the bridle. So at first glance, it's like a leather halter, but if you look at it, or leather head collar, it's got a piece of metal that goes in the horse's mouth called a bit. That's how we steer horses. The reins run from the bit, and they're what the rider holds in the hand when they're riding the horse. Other than that, though, you can see it's similar. We've got a headpiece. This time we've got a brow band to make sure that the bridle isn't going to slip or slide off. There's a throat lash goes underneath the larynx. That's left a lot looser than a head collar. We've cheek pieces and we have a noseband. So you can use a bridle as a extra means of restraint. If you're not riding the horse, you just lift the reins over the horse's neck and use them like a lead rope. But because there's a bit in the horse's mouth, you're giving yourself extra restraint. Horses have been taught to respect the bit. So what you'll find is the horse that will try and drag you around the yard in a head collar and lead rope, as soon as you put a bridle on them, they'll respect the bridle and they'll stop trying to pull away from you. And that's what we want to achieve whether you're leading a horse or riding a horse, if it comes down to a pulling match, the horse is going to win. So it's about trying to find ways to handle the horse that doesn't end up in a row or a pulling match. So having something on the horse that it respects and goes along with it is obviously a good way to achieve that. So we can use a bridle. We can also use a chiffney, and this is basically a special type of bridle. It's really simple. You can see there's just one leather strap that goes behind the horse's ears, and there's this round bit that goes into the horse's mouth. So you can see it here. It's a round or a port-shaped bit. And the advantage of a chiffney is that you can put it on directly over a head collar. So with the bridle, you've got to take the head collar off to put the bridle on. There's a bit of fiddling to do. Whereas you can just pop the chiffney directly on over a head collar and then clip your lead rope to the ring on the back of the chiffney, as well as the ring on the bottom of the head collar. So you can see here in this photograph, this lead chain has been passed through the ring of the chiffney, through the ring on the bottom of the head collar, and clipped back onto itself. Really important. Don't attach the rope or the chain to the chiffney only, because if you do, when the horse pulls, it makes the bit rotate in the horse's mouth and press onto the roof of their mouth, and that's uncomfortable for them. We don't want to do that. So it is important to ensure it's correctly fitted. You will find, however, that once a chiffney is on a horse, again, they tend to respect it and they stop pulling. So the minute the horse tries to pull away from you, the chiffney presses on the bars of their mouth or their gums, and they respect that. And if they kept going, it's going to hurt, so they'll stop. As soon as they stop pulling, you release pressure on the rope. That's really important. You have to reward the horse for doing the right thing. So this is equine learning theory. As soon as the horse goes to pull away from you and stops, you stop pulling in return. So you're rewarding the horse by doing what you want them to do. If you keep pulling and you're teaching the horse that there's nothing they can do to get away from you, and they're going to pick a fight with you because you're not giving them any other choice. You're not teaching them that if they relax, they get rewarded. So that's really important. In terms of how to fit a chiffney a bit more on them, there's a link on Moodle to a page on vetnursing.ie that goes through them and explains in a bit more detail how to use them. So you can have a look at that. But really, really useful and valuable bit of kit to have in your practice. Other things we can do, physical restraint, we can lift up a leg. So we can have the horse going from standing on 4 legs to standing on 3 legs. That often temporarily keeps them still, and it can be a quick and easy way to just get a bit of extra restraint if they're fidgeting, for example. Say, for example, a horse keeps moving around when your colleague is trying to inject it. If you just lift up their leg for a minute, it can help keep them still. You can also take a grip of their skin like this. So this is a grip on the left-hand side of this horse's neck. We just picked up a handful of loose skin and we're holding it in my fist. Couple of things to bear in mind. You need short fingernails for this. There's no place for long fingernails in equine practice, but particularly for this job, we don't want to hurt the horse. And the other thing is, this gives you good restraint. The horse will just keep still for short procedures. So again, it can help you if you're trying to inject a horse and he's a bit resentful of the needles. But you will find after sort of 5 or 6 minutes, the muscles in your forearm will start to cramp and seize up. So it's not something you can do for a long time. If you're doing this with a colleague and they're starting to get tired, talk to each other and stop temporarily to allow the person to relax and get the blood flow back into their hand. And just to mention ears, a lot of adult horses don't like you touching their ears, or particularly don't like you trying to hold on to them. And if they end up having a bad experience, they can become what we call head shy, where every time you go to handle their head, they throw their head up in the air and try and get away from you. And that's really frustrating for owners. Clients may have spent a lot of time and effort teaching the horse to trust them and to trust humans. And then if the horse goes into hospital for a week and comes home head shy and no longer trusting humans, it's making their life a lot more difficult. So we might have fixed what was wrong with the horse, but if we haven't handled and restrained them well while we're treating them, we can end up with an animal that's difficult to handle, and that's obviously problematic. So my experience is leave horses' ears alone as much as possible. Other parts of the world, they're keener to hold them by the ears, certainly in North America. I think that's just due to different populations of horses. A lot of horses in North America are what we call quarter horses, and they're very, very placid. In this part of the world, we've a lot of thoroughbreds and sport horses. They're much what we'd call sharper. They're quick and they're intelligent, and they're on the go all the time. But they will take on to fight a human if you try and argue with them. So my advice is leave their ears alone. However, it is very useful to restrain foals. So that gently grasping the base of a foal's ear is a good way to restrain their head while you're giving an IV injection, for example. But again, just be sensible. Don't twist or bend or pull their ear excessively. All you want to try and do is grasp their ear to keep their head still. That's plenty. Sometimes stopping the horse, seeing what you're doing, can be handy. So you just need to temporarily restrict the horse's field of vision, so you can hold your hand over their eye. If, for example, you're trying to inject a horse on the left-hand side and your colleague is holding it for you, and as you approach the horse, they're getting anxious, you can just ask your colleague to temporarily cover the left eye with their hand, and then the horse won't see you approach. They'll know you're there, you're still going to chat to them, but by covering their eye, a lot of times you'll temporarily reduce their fidgeting or resentment of the procedure. If you want to cover their eyes and keep your hands free, you can just use a towel or a tea towel, tuck it into the head collar, but make sure that if the horse struggles, the blindfold will fall off. Never tie a blindfold onto their head. If they get loose, they'll just panic and crash into things, and that's obviously a disaster. Tail restraint, again, useful in foals. Adult horses generally leave their tail alone. We might push the base away as you take their temperature. That's about it. They often resent having their tails handled. But with baby foals, you can stand, if you're restraining a foal for somebody else, you can stand with your abdomen at the foal's ribs, put one hand underneath its neck, up the side of its face, and gently grasp the base of its ear, pull its head in against your body, and then with your other hand grasp the base of the tail as close to the body as possible, and gently lift their head up. Okay, and you'll find most foals will stand there for you at that. However, again, don't start swinging out of them. If you twist or pull the tail, you're going to hurt the foal, and you also end up bending over them a bit. So just keep your head turned to one side. If they do rear up and you put your nose straight over them, you get a painful smack on the nose from the back of their neck. It won't do any major harm, but it's a bit unpleasant. Another useful tool then, moving on to additional methods of restraint, is a twitch. This has lots of different names. It can be a grin or a touch, or there's different terminology in different parts of the world for it. But what it basically consists of is, just move this out of the way. It's a handle made of either timber or plastic. I prefer plastic, so you can hit in the head with it. It doesn't really hurt. With a loop of rope on the end. And I actually prefer homemade versions as well. You can buy commercially made twitches, but they usually have wooden handles, and in my experience, I don't want to get hit on the side of the head by a wooden handle, so I prefer a homemade version. You put a rope loop on the end that's big enough to get the horse's top lip and your fingers through, and then to put it on, you restrain the horse's head, you put the loop of the twitch over your wrist, and then grasp the horse's upper lip. Flick the rope off your wrist onto the horse's lip, and then twist the handle of the twitch with the other hand to tighten the loop around their nose, making sure your fingers are out of the way. And you twist until the rope starts to sit into their nose and the nose starts to elongate. That's tight enough. And what it does is it causes endorphin release. So you get a temporary kind of 5 to 10 minutes where the horse will stand a bit like they're in a trance. Okay, and it allows you to do invasive procedures more safely. So for example, let's say you have a horse with an infected leg wound and you need to lavage it and treat it, but the horse is very painful, and every time you try and approach the leg, it's getting agitated and it won't let you. So what you can do is you can put a twitch on the horse to allow you to sedate it, give it some painkillers, and get some local anesthetic into the leg. Then take the twitch off, let the drugs take effect, and then go ahead and work on the animal's limb without fighting with them. So very, very useful for short-term restraint. It allows you to handle horses safely that otherwise wouldn't be amenable to being handled. But it is important to pay attention. Some horses don't like the twitch, and they'll try and rear up and strike out with their front feet to get rid of it. If you're in front of them, you get kicked in the head and potentially killed. And you won't see them coming. You won't have any warning. They just do it in a second, and the first thing you know about it is you're kicked. So make sure, this is why we talk about staying slightly to one side, never standing directly in front of them. And that's particularly true when they're wearing the twitch. So always pay attention. Watch the horse. If it's starting to get restless or if they start to breathe more rapidly, it's time to be taking the twitch off. If you want to move a horse that's wearing a twitch, you always move the horse by pulling the lead rope, which is attached to the head collar. Never pull the twitch. You're going to hurt them. So it's important to pay attention and avoid hurting their nose or damaging the animal. And the other thing is the loop is important. You can see the picture there in the top right. The loop's made out of soft white rope. The one on the left is blue nylon rope. That's okay, but the softer the rope, the better. I don't want to mark the horse's skin with the rope, so definitely avoid bale and twine. That tends to mark their nose, and chains for the same reason. You can buy commercial twitches that have wooden handles and metal chains. I just think all they're good for is hurting yourself and hurting the horse, so I tend to avoid them. This shows you how to hold a horse that's wearing one. So stand to one side, paying attention. You're holding a lead rope in one hand and the twitch in the other, and you're watching the horse like a hawk. And if you need to move the horse, you ask the horse to move and pull the twitch. You pull the rope. You never try and drag a horse anywhere. You always indicate to them what it is you want them to do. The bottom picture here is another twitch. This one has a nylon bale and twine loop. I'd prefer to get rid of that. And the other thing is, see the way the knot here is out on the edge of the loop. Go back to the previous one. I've made this one with the knot inside in the handle where it won't push on the lip and hurt it. So pay attention to the design. You can also get these commercial metal, they're made of aluminium, they're really light, self-retaining twitches. So if you're working on your own, you can put the horse's nose into this narrow part here, then tighten the handles. You wrap the string around the handles and then clip this little clip here onto the side of the head collar to keep the twitch in place so that you're having to hold it. In my experience, they just fall off. I wouldn't consider them to be very useful. And I also don't like the fact that there's a little catch up here that can pinch the horse's skin and mark them. So in my experience, these aren't really that useful. They're sometimes sold as humane twitches, which I think is just a marketing ploy. In my experience, they're not that effective. So a few take-home messages with twitches. Pay attention while it's on. Always watch the horse like a hawk. Don't put twitches on an ear. So in this part of the world, it's considered very poor horsemanship. You just make the horse head shy. You will see it described in some textbooks, especially those from North America. As I say, it's a cultural thing. But in this part of the world, people will very much frown on you if you're doing that, and it's considered to just be an excuse for poor horsemanship. It's not something I'd recommend or do. We mentioned avoiding chain or twine. The other thing is you need to be able to disinfect the twitch after you take it off. So plastic handles and soft rope, you can disinfect it clean it using water and detergent, and you can disinfect it in something like Virkon or Trigene. And then there's a link on Moodle for more details. Have a look at that. And just to briefly mention hobbles, they're very old school now. Before the invention of modern sedatives and anesthetics, they were used to help restrain horses prior to surgery. You'll very rarely see them used now, other than say when mares are being covered and you don't want them to kick the stallion. If you have a very valuable stallion, you don't want them getting injured. Sometimes people will hobble mares, but other than that, you'll never see them used. Animals they can panic in them unless you know what you're doing. So really, they're only really used by experts in breeding sheds. They're not routinely used in practice anymore. Stocks, however, you will see a lot of. So stocks is basically a small horse-sized pen we put the horse into. They're big enough for the horse to stand in, but he can't turn around or climb out of it, hopefully. There's different types. This is kind of a more modern type with open sides. The original stocks were this type, which have very enclosed wooden heavy sides. And some horses can get quite claustrophobic in those and start to panic. The other problem with this old type is that they're designed for use on stud farms for stud medicine, where you're doing a lot of ultrasound scans on mares' ovaries. And you can get at the horse's head and you can get at their backside, but that's it. The rest of the horse is obscured by the wooden sides. Whereas with the more modern type, you can see the sides are open. So you can put a horse in here to scan its leg or to lavage a wound or to give it fluids. So they're a very good way to allow us to restrain horses and reduce the risk of us getting kicked. You can stand in front of a horse or behind a horse when they're in a stock, so it reduces the risk of getting kicked. They do need to be really solidly constructed and buried deep into a floor. Bolting to the floor is a waste of time. If a horse panics in them and trashes around, they'll just come apart. They also have a quick release knob. You can just see here on this photograph at the back here, it's hard to make out in the photo, there's a little black knob there, and that's a quick release spring loaded catch. If the horse panics and goes down in the stocks, you can hit that black knob backwards and this side of the stocks will come off, so you can let the horse out rapidly. The top's also padded here in case the horse rears up or tries to climb out so they don't hit their head. So very useful bits of a kit. Another type, these are even more open to allow you to and getting around the horse's legs, and very, very handy for use in equine practice. You can see this horse is having a cyst removed from his back, so he's been sedated. He's in the stocks. We put local anaesthetic into the region that we've clipped up, and the surgeon here is removing little cysts from the animal's back. And you can see there, the surgeon standing on a stool. It wouldn't normally be safe to do this beside a horse that's conscious, but in this case, the stocks make it that bit of a safer work environment. Just to mention as well with them, you can see this this type has a door, so the horse has to walk in and reverse out, whereas most of them have a door at the back and the front. So to put the horse in the stocks, you open both doors. One person walks the horse into the stocks and stops them, and then the second person closes the back door. Always close the back door first. If you close the front door first and the horse goes into reverse, the person who was holding the horse has to let go. So you never want, there's nobody in the stocks with the horse. That's unsafe. The humans have to be outside the stocks. So always close the back door first and then close the front door. At that point, then the horse can't go anywhere. It's safely restrained. Just a picture of lots of other uses for them. This is a horse getting some intravenous fluid therapy. So you can see the fluids are hanging up here on the stocks. The horse has been sedated. He's tied up to a loop of string here attached to the stocks. You can see the lead rope is short, so he can't put his head over it. And he's just standing there while the fluids run into him, and the vet can do other jobs or whatever you need to do. Bear in mind, however, you got to watch if they get very heavily sedated and their head is lying down, they can cut off their own airway on the front door, so just keep an eye on them for that. Chemical restraint, we can sedate horses if needs be. So similar to small animals, we can give them an alpha-2 agonist plus or minus an opioid, usually butorphanol. The alpha-2s we use are xylazine, dotamidine, and romifidine. Xylazine has the shortest duration of action, romifidine the longest. You give them IV and they last somewhere between sort of 15 and 40 minutes, depending on how much you give and how agitated the horse is. The calmer the horse is when you give them, the better an effect you get. You can also get oral dotamidine gel, which has a slower onset, but it's not that useful, to be honest, but it is on the market for horses that are needle shy. But I think it's just better to train the horse not to needle shy, personally. Bear in mind that when a horse is sedated, they'll stop moving and they'll hang their head down, and they'll be much, more kind of amenable to you doing things than normal. But they're not unconscious. They can still bite and kick, so keep that in mind. Don't get lulled into a false sense of security. You still never stand in front or behind them, for example. We can expect some side effects as well. Some horses sweat up quite dramatically when you give them. Sometimes they'll urinate, and they may shiver or twitch when you handle them, and their blood pressure can fluctuate a bit. So, when the vet is prescribing these medications, they're keeping those side effects in time. If, for example, you're trying to clip a horse and you say to them and they start to sweat up, it's going to make clipping them very difficult. Unlike small animals, we don't use reversal agents. We just wait for the drugs to wear off. So we don't normally give them a reversal agent once we're finished. And I've put acepromazine in brackets. It's available on the market as an oral sedative gel. It doesn't actually sedate them, just drops their blood pressure. So it's not that widely used and it's not very effective, but you might come across it from time to time. It is used in pre-anesthetic protocols. So just that you're aware of it. Okay, this is what a horse that's been sedated looks like. So you got this characteristic, what we call a wide base stance. They move their front legs further apart than normal. They hang their head down, their ears are relaxed. They usually elevate their top lip, so they'll elongate their lip, and they'll have a kind of a relaxed, sleepy or dreamy expression. Sometimes they'll fiddle or kind of fidget or twitch their top lip. And they'll sometimes kind of sway gently from side to side. And also you can see this horse, he's resting his back leg. So that's a typical picture of what they look like while they're sedated. If you go to lead them around the place, they can still walk, but it's like they're a bit drunk. So again, you've got to be careful, no sudden turns or stops. Just be careful with them. If you're leading a sedated horse, they're not as coordinated as they normally would be. And as I said, they can still bite or kick, so do pay attention. Foals then, just to mention, foals are a bit different to adult horses. I mean, they're obviously smaller, first of all, but also, as I said, most adult horses are placid. If they are aggressive, it's usually because humans have taught them to be. You'll very rarely meet an aggressive foal. They're generally just scared and they'll try and get away from you. However, once they get used to humans, they are naturally curious and they'll want to come over to you. So what you want to try and do is keep them relaxed and calm around people. if you're getting agitated, they'll squeal. So if you're handling a foal and it starts to squeal, that's a sign that they're in distress. In nature, that's a sign to get their mother to fly over and see what's going on. So if a foal is starting to squeal, the mare can start to get very agitated. So be careful. You should always have somebody holding the mare before you ever go to handle a foal. It also means the foal is agitated, so you're better off stopping what you're doing and just try to calm things down. Unlike adult horses, if you're holding them, they'll start to kind of suddenly slump towards the ground. So you'll suddenly find the foal is starting to bend at the knees and it's heading down towards the straw, and you're starting to follow them, and you get to about bent over at your waist, and the foal suddenly leaps up into the air and smacks you on the nose. So that's what they tend to do if your restraint is too aggressive. If you feel the foal starting to trying to slump away from you, just tell the person, which I'm going to have to relax my grip on this foal, and let them relax, and they'll stand back up. If you're over aggressive with them, they get really, really stressed. So really important, when it comes to restraining foals, you only need to hang on to them for the 30 seconds you're sticking a needle in them, not the 5 minutes while you're clipping and scrubbing the catheter site, for example. So just play it gently. You don't want to hurt them by restraining them too severely. You do need to have enough restraint that they don't move and hurt themselves, but there's a happy medium. Bear in mind as well that they love being scratched, and it is important when we're handling horses, there's no good fixing their physical health if we don't also keep them well socialized and trusting humans and enjoying human interaction. It's very easy to sour a horse if all we ever do is stick needles in them while we're looking after them. So very important to spend some time with them. This is a foal in the hospital, and one of my colleagues, Ingrid, is going to give the foal a scratch. You can see the foal is enjoying this. She's straight over to say hello, and she's learning that humans are trustworthy and are enjoyable to be around, which is really important. We want this foal to go on and have a productive life as an animal that will work with humans. So we've got a responsibility to the animal for their future well-being to handle them well and ensure we don't teach them to distrust or dislike humans. In terms of catching foals, what you do is you walk into the stable with 2 people, and the first person straight away, first thing you do is catch the mare, put a head collar on the mare and lead her up. Then if you reverse the mare into a corner of the stable and approach the foal will instinctively run in beside Mammy. You now have the foal trapped in this corner between the mare and you. And then just quietly walk up to the foal and put your hand across its chest, the other hand across its bum, and now you can direct the foal backwards or forwards as required. If you have to restrain them a bit more tightly, you can put one under their neck like this and then hold the tail with the other hand. Now I'd prefer if this guy was holding the foal's tail as close as possible to the hindquarters, but by lifting the tail up a bit, you can keep the foal still. And you can see as well, Mammy is here beside the foal, so you always keep them as close together as possible. That way they're going to be more relaxed. And this is a foal that's been restrained. It's got a entropin like we saw in the lambs in Ballyhaise. We're going to put a suture in the eyelid to protect its eye and let it heal. So we've sedated this foal. It's lying down in lateral recumbency. We're gently holding the base of the ear to keep its head still. We've put a folded towel under its eye so the straw doesn't poke it. And then I'm holding this is me in the maroon sweatshirt. I'm holding the foal's lower limb in my hand, keeping it flexed so this foal can't get up. And the picture's a bit misleading there, but my knee isn't touching the foal's chest. I don't want to restrict its breathing. Myself and my colleague are working from the foal's spine. So if it does start to flail its legs around, it's not going to kick us. So you always work from their spine if possible. It's the safest place to be. A few odds and ends before we finish up this section. You'll encounter some horses that are hard to catch in the stable. So most horses, you go into the stable and they stand there and wait for you to catch them or they come over. But if they're moving away from you, don't just persist in chasing them around. At best, you're going to frighten them. At worst, they might try and kick you. If they're moving away from you, they're scared or they're reluctant to be caught. So what you want to try and do is convince them that being caught is a good idea. So a couple of options. This horse was a little bit shy, so we found the best way to catch him was we used to just open the door of the stable and wait for him to come over. And then once he put his head out and saw what was going on, he'd then stop and let you catch him. We opened the door just enough for a human to fit in and for him to put his head out, but not enough for him to get out. And with this particular individual, we found that worked well. He then quietly let us catch him. If he went into the box before he was ready, he'd just get anxious and keep trying to get away from you. He was a nice horse, he was just a bit shy. Other tricks, you can try tempting them with food. Some horses will respond to food at this point, others won't. You can try a handful of course mix or an apple, or you can make a little rope to leave attached to their head collar. So this is an old lead rope clip with a plaited piece of baling twine attached to it, which is about 14 inches long. So it's long enough that we can quietly walk up to the horse and catch the end of it before the horse moves away, but it's not so long the horse is going to step on it. That's really important. We don't want to be trailing around and annoying the horse or getting in the way where he can get tangled up in it. So that's a handy trick you can try. Okay, so that's an overview of equine restraint. If you have any questions on it, I'll ask you to post them on the Moodle forum so I can respond to them for you. Have a look at the resources on there and have a read through the notes. And if you have any questions, as I say, pop them up there and I'll answer them for you. Okay, thanks very much.